For indigenous people, psychedelics are a way of opening doors to the spiritual or imaginal planes. They were not really seen as treatments for disorders or treatments for problems. They were used to access vital information, to help tribal cohesion and to help tribal survival, also to engender pro-social values for people. They were used to facilitate healing and predict the future or divine the future, to protect the community from danger, enhance learning, solve social problems, and facilitate the dying process. In fact, psychedelics have been recorded as part of a number of life cycle transitions in a variety of indigenous cultures: birth, death, maturation, boyhood to manhood, rituals, marriage, and childbirth. So what is existential distress? Existential distress in this context is pain that results from questioning the very foundations of life, whether my life, whether this life has any meaning, purpose, or value. Existential distress is characterized by fear, anger, terror, sadness at the prospect of not existing, and a loss of purpose in life, and a loss of meaning in life. The goal of the therapist is to support the medicine's effect and the participant's immersion in their inner experience. We did not do very much talking with the participants during their journey unless they really insisted on it. And even then, we tried to just talk for a little while and then have them return to their inner directed work with the earphones and the shades, and eye shades. We did not give them any encouragement to think about cancer. We encourage them to practice a radical acceptance of all that emerges during the session. When you're with them, they endure and learn and have a profound experience as a result of going to that edge. You certainly see this in psychoanalytic work. So the first theme that emerged was relational embeddedness. And I think this really should have been called embeddedness in relationship, or embeddedness into relationality. But people talked about profound transformations in their personal relationships, often emotionally laden with grief and hope. People reported a great sense of emotional depth. They just felt more, a lot more, far more than they did in ordinary day-to-day life. They had intense feelings of bliss, joy, and love, as well as despair and fear and sadness and grief. They had disparate emotions that changed quickly. Sometimes they had opposing emotions at the same time, and these were always linked to meaningful narrative. People felt that they were shown, or they were given, wisdom. They received transpersonal insights into the nature of the universe or existence. And these are often things that if they were said in regular words, they would seem trite or cliched, but as a felt experience about the unity of all things, or the essential core of love as the most important force in the universe. And they reported lasting changes to their sense of identity, greater confidence, ability to overcome barriers, changing problematic behaviors, and a sense of being reborn. Transpersonal psychology is about helping individuals explore their spiritual side and work with repairing any shattered pieces of their souls. So if you ask a traditional psychoanalyst the difference between a soul and a psyche, they won't really have a very coherent answer for you. But a transpersonal psychologist will. A transpersonal psychologist is a specialist in understanding spiritual work, spiritual growth, spiritual illness and malady, spiritual reemergence, and integrating this as part of the human being.